All right, we're going to go ahead and get started today. Welcome everybody. I know people will be joining as we go through this today. So feel free to always put questions in the chat, what organization you represent, what county you're in. You can also use the Q&A function for questions. We'll answer questions at the end, but I don't want you to forget those questions. So feel free to put them in as we go. I have a wonderful team presenting with me today. We might be able to answer them in the chat as well as we go, but for sure put them down so we don't forget them. A little bit of a housekeeping update first is this is obviously being recorded. After the webinar today, you all will get a recording of this presentation. You'll also get a PDF of the slide deck, and you'll get some other links and resources that we'll talk about today. So that's kind of a little bit of the housekeeping. Before we dive in, I just want to take a moment and pay attention to this slide right now with all these beautiful baby faces that you see on your screen. These are just some of the babies saved with Count the Kicks, our evidence-based stillbirth prevention program that you're going to learn more about today. So if you're new to Count the Kicks and you're just learning about it, great. I hope you walk away with a lot of tools and resources to encourage you and help you talk about stillbirth and stillbirth prevention with your patients and clients and community members. And if you already know about Count the Kicks, I hope you walk away learning something new today. We have some new research and data out that I think it'll be really important for you to take back with you to your communities as well, because we can't do this alone. And it's because of you taking time out of your schedules today to have this conversation and to listen to us and to take that back and be those boots on the ground. And that's how we're going to save babies together. So with that, I'd like to do some brief introductions. My name is Megan Ockett. I am the program director with Healthy Birthday, which is the nonprofit organization that created Count the Kicks. So today we're obviously talking about Count the Kicks. That is our stillbirth prevention program. I have been with the organization for about 4 years. My background is in public health. I used to work for the Iowa Department of Public Health. We're located in Iowa. We were founded in Iowa, but we are a national organization. And so my background is public health. I'm really passionate about maternal child health, especially how it works within systems and how we can integrate Count the Kicks easily into your workflow, whether you're a WIC, a labor and delivery, a doula. What does this look like for you? And how can you integrate this to make this easy for you to replicate in your area? And so I'm really excited to be here today. And I'm so, so grateful to be here alongside my two wonderful co-presenters, Maria and Erica. Erica, would you mind introducing yourself for everybody?
Hi, everyone. I'm Erica Bailey, and I'm one of your local Missouri Count the Kicks ambassadors based in Kansas City. And the reason I'm here is because it is my mission now that every birthing parent, not only in Missouri, but everywhere, knows the importance of paying attention to their baby's movements and speaking up if they feel a change. And the reason this is so important to me is because my very first baby, my first pregnancy, my son, Roan, who you see in that picture I'm holding, he died at 39 weeks, just days before my due date. He was stillborn because I was not educated on fetal movement. I was not educated on stillbirth. So I had no idea that I should have spoken up in those last weeks when I felt him slowing down. And come to find out, he was stillborn because he had an undetected small placenta that just gave out at the end. And he also had blood clots in his cord that were evidence of multiple compression events. So it makes complete sense now why he was slowing down in those weeks. And it wasn't because he was running out of room, and it wasn't because I was getting close to going into labor. There were red flags there that I wasn't educated about. So it is my passion now to educate everyone because this is so important. And since Roan was born, I have had 2 live births. So I have 2 living children now. And one of them was a Count the Kicks baby save in 2021, which you will hear about a little bit more in a little bit. I'm going to pass it to Maria.
Hi, I am Maria Walsh, and I live in Kansas City with my husband and our 3 kids. Oliver lives in heaven, and we have our 2 living babies, Elsie and Miles, that live here on earth with us. I've been an educator in the public school systems for 15 years. My husband is a firefighter for Kansas City Fire Department. And as an educator, kids are my passion. And so I could not wait to become a mom and have my own babies. So we found out I was pregnant with Oliver on my birthday, and we were thrilled that we were going to make that dream come true. My pregnancy was very uneventful. At our 20-week scan, he was perfect, healthy baby. And little did I know that would be my last time that I would see him move or see him at all. That was my only monitoring. I went through my pregnancy, everything went well, all my appointments checked out well, up until about my last 3 weeks of pregnancy. I had noticed a change in his movement, and at my last 3 appointments, I had told my provider that his movement had changed, and all she had said to me is, movement does change at the end, it's okay. And as a first-time mom, I just took that and I believed the professionals. I went on with my days of teaching, knowing that my movement had changed, but the professionals had said movement changes at the end. I was never asked what I was feeling, just told that movement had changed at the end. So we heard his heartbeat on a Monday. We went in 2 days later to think that we were going to have our healthy baby boy. And we heard those dreadful words that there's no longer a heartbeat. So then we had to prepare to go through labor and delivery, knowing that we were going to deliver a dead child. Holding a dead baby, your family flying in and coming in as fast as I can to meet him is something that sticks with you for the rest of your life. We will never be the same people that we were before we lost Oliver. Would have been 8.5, and there's still not a day that goes by that we don't think about him. We don't talk about him. My husband, who's this big firefighter, every morning before work, he rubs his urn before he goes. Every night before he goes to bed, he rubs his urn before he goes to bed. It's part of our lives. It's built a lot of anxiety and worry in us that we never had before losing Oliver. We're so blessed to have our living kids. But that next morning after we lost Oliver, my OB had come in, and she was not the one that delivered that day. And she had been crying, and she sat down in bed with me, actually almost laid in bed with me, both of us sobbing. And she said something to me that still sticks with me to this day of, I just should have sent you in for more monitoring. You told me that your movement had changed. The problem is it was a yes or no question. It wasn't open-ended. It wasn't tell me what you're feeling, because I know if she had said, what are you feeling? We probably would have delivered Oliver 3 weeks earlier. I was not feeling him in me. I was feeling lumps on the outside of my stomach that I now know were early contractions. He was telling me for 3 weeks that he was struggling, and we delivered him. He was smaller. He was about 5 pounds at 38 weeks and 2 days, which is small. My placenta was very calcified, and so we know that it was growth restriction at the end. And he was telling me for 3 weeks he was struggling, and the only factor that I had, the only red flag, was that his movement had changed. But as a teacher, it so frustrates me to this day that I was not properly educated on what I should be feeling. I wasn't feeling him inside me. So I am here today to make sure that no other parents have to go through that ungodly experience of delivering a dead child and then going through life of knowing that it could have been prevented. So I really, truly appreciate you taking the time and being here today and having that dedication to decrease the stillbirth numbers in our state. I truly appreciate your dedication for you being here today.
Thank you, Maria and Erica, for sharing your stories and sharing a little bit more about Roan and Oliver, and being brave and sharing that with everybody on the call today. I think it's really important, it's valuable, and this is why we're here. We want to make this an everyday conversation with your patients and parents. And so that is what we're hoping you walk away with today. Before we kind of jump right in, I would love for Dr. Canafani to share a little welcome with everybody today. So go ahead, Dr. Canafani.
Yeah, hi. I'm really happy to be here. And like Megan said, I'm Dr. Canafani. I'm Chief Medical Director here at Healthy Blue, Missouri, one of the 3 managed Medicare plans. I've been really, I have recently myself just learned about the Count to Kicks campaign and have been just really thrilled to be part of it. In however small my role has been. I'm really happy to see all these different people from all around the state joining today, taking time out of their schedules to prioritize this webinar. I am from Missouri and have practiced pediatrics in St. Louis and recognize so many of you who have put your locations in the state. I'm really struck by the diversity. I'm really happy to see folks in the doula space here. Our organization is very invested in bringing doulas to Missouri. So I think this is a really important public health issue. I think Missouri, as everybody knows, is struggling a little bit in the maternal infant health space, and anything that we can do to improve the lives of birthing persons in Missouri is well worth the effort, especially since it is, thinking about this relatively, and I don't want to oversimplify, but relatively simple to do Count the Kicks. It's an evidence-based stillbirth prevention program that has research to support it. I was reading the study myself the other day from Scandinavia. One of the things I'm always think is so important is to implement public health programs that don't have, frankly, a lot of cost to them, and that don't result in a lot of potential side effects, as we like to say, right? Getting moms more engaged and tuned in to decreased fetal movement, DFM, is something that, the healthcare system probably does fairly regularly, but with a lot of variability in how well it's implemented. So with Count the Kicks, what we're hoping is that there'll be a kind of a rallying cry around this relatively simple modality to really move the needle on stillbirths. We continue to experience stillbirths at a very high rate in the United States. And again, just the definition of that is losing a baby after 20 weeks. It is still a leading cause of death for babies, more than preterm birth, SIDS, accidents, drownings, guns, and all of those, tragedies combined. 1 out of every 170 pregnancies in Missouri ends in stillbirth. So, at Healthy Blue, we have always been very invested in improving the health of our birthing persons, of women with both at risk and, not at risk pregnancies. How do you know, right? So I'm glad you're here. I encourage you to spend the next 60 minutes listening and kind of really thinking about how you and all of your different backgrounds and positions can use Count the Kicks and get it to the moms that we know need it. So it's a program that's obviously national, like Megan said. It's being implemented in other states, and we're really happy to have it in Missouri. And, I'm just happy to be here. I feel privileged to be part of this, and I'm very thankful for you, our community of providers.
Thank you so much, Dr. Canafani. And we are so thankful for our collaboration with Healthy Blue. It's really why we're here today, is because of this partnership with Healthy Blue. And we really want to align ourselves with other organizations that value equity at the center of all that they do and maternal health. And so this partnership just makes sense.
And here's my
there's your app.
Right
you
here.
got
oh,
it.
it's so out of focus. It's so bad.
No,
okay,
that's
there it
good.
is.
Yep, there you go. You got it. We're going to ask everybody to download that here shortly.
Very easy to use.
Yeah.
So.
Awesome. Thank you so much.
Well, before we begin, we wanted to show you a video so you can see how Count the Kicks saves lives.
We're going to turn now to that GMA parenting alert about a free app a mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble.
For Emily and Jeremy Ecoff and 2-year-old Liam,
oh, nice.
Life with their new baby Ruby is extra precious.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did. And when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden, they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby.
Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
So that is the power of mom to mom and parent to parent sharing. And now I want to take a moment to talk about 2 very special little ones. These are 2 baby saves from right here in Missouri that we know about, but we know that there are more baby save stories out there. These are just 2 stories where the parents contacted us to share how Count the Kicks helped save their baby's life. And I am very biased, but the little boy on the right named Bear is my son. And it like makes me emotional, but he is my baby saved. And what happened was, so like I told you guys earlier, after my first son died, I went in a deep dive searching stillbirth and everything about stillbirth. And that's how I found Count the Kicks. So you better believe when I got pregnant with Bear, I used Count the Kicks religiously when I hit 26 weeks because I was high risk now. And when I came to 36 weeks, normally every day when I would wake up, I would easily feel 10 movements from him very quickly, on like clockwork. And on this particular morning, I didn't. He was feeling slow. So immediately alarm bells went off. And if I hadn't already had my MFM appointment scheduled within that hour, I would have headed straight to labor and delivery triage. But I went into my appointment and they did the non-stress test and they could see that he had non-reassuring cardiac activity. Then they sent me to do a biophysical profile and they ended up passing him with all the points and they wanted to send me home. And I told them, no, his movements still do not feel right. This does not feel right. Just that intuition. Plus I had the data from the app that I knew that his movements were off. So they decided between what I was telling them and then the non-stress test and then my history that, okay, we're going to admit you. And because of that, my son Bear was born healthy and alive the next day at 36 weeks and 1 day. And I know it's because I was empowered with this information to speak up. And they listened to me. That's the other important part. They listened and they believed me. So I'm so thankful he's here. And I have no doubt that if I had known this information in my first pregnancy, Roan would be here too. And Bear is now a healthy, happy 2.5-year-old boy. And our lives are just filled with joy because he's here. So very thankful for this app. So in the state of Missouri, we're going to tell you how we have a tool ready to go now. We have the ability to save on average 136 babies born here every single year with our program.
So what is our program? Like we've mentioned earlier, it's evidence-based, and we're going to talk about the evidence here in a little bit, but it's an evidence-based stillbirth prevention program. We educate expectant parents on the importance of tracking fetal movement, and now you will take this information and educate expectant parents in your area on the importance of tracking fetal movement. And then what I love most about this, it's empowering. You just heard Erica talk about how she was empowered and she said, no, this is not my baby's normal. I need additional testing. I need to be listened to. And she had the data. So we're empowering expectant parents to speak up to providers if there's a concern. So let's just level set to make sure we're all on the same page. And since we're all within maternal child health, I think we are, but I think what's really important about this slide is the takeaway of just the total number of babies that are born still every year in the United States. So stillbirth, like Dr. Canafani had said, is the loss of a baby after 20 weeks of pregnancy. On average, we lose 22,300 babies are born still every year in the United States. That's 65 babies a day. That is like a busload of kindergartners, a classroom class, a kindergarten class. If that was happening to a busload of kindergartners, that would be in the news, right? That would be talked about all over. So why aren't we talking about this? We need to be talking about this. We have to change the narrative, but we need your help. Infant mortality, which is the one that commonly gets confused with stillbirth, is actually the death of an infant before his or her first birthday. On average, you lose around 20,000 infants every year in the United States. And then miscarriage is usually defined as the loss of a baby before the 20th week of pregnancy. So I want to draw your attention to the fact that we're losing slightly more babies to stillbirth than to infant mortality. And that's not to underscore the devastation and tragedy that infant mortality is. It's to highlight the fact that we do so much to prevent infant mortality, SIDS, Back to Sleep campaign, all of these wonderful efforts. That's what we want to do with stillbirth and stillbirth prevention. We want to make Count the Kicks, fetal movement monitoring, commonplace, common practice, where we're talking about it, we're having open-ended questions. We want to move out of the darkness and talk about this, because if we don't, nothing's going to change. So just taking a little bit closer dive nationally of that 22,300 babies that are born every year in the United States, we also know that families are 6.5 times more likely to lose a baby to stillbirth than to SIDS. So it's 1 in every 173 pregnancies nationally will end in stillbirth. And the racial disparities that exist and persist are unacceptable. Native Hawaiian or other Pacific Islander pregnancies, 1 in every 94 pregnancies will end in stillbirth. Black pregnancies, 1 in 97, Indigenous pregnancies, 1 in 128. Native Hawaiian and Black pregnancies are 2 to 3 times more likely to experience a stillbirth over their white counterpart. We're going to talk a little bit later on about what Count the Kicks is doing to address these disparities that exist and think through what you can do to address these disparities that exist.
On the state level, our stillbirth rate in Missouri is not very good. Per 1,000 births, our rate is 5.83 of those babies will be born still. So what that looks like in terms of number of babies per year is, on average, 425 babies are being born still every year in Missouri. My son was one of those babies. Maria's son was one of those babies. This is truly a public health crisis. And looking at the stillbirth rates by race, it is very easy to see those racial disparities. So that first bar are for white birthing parents. The purple bar is for Hispanic or Latino birthing parents. That turquoise bar is staggering for Black and African American birthing parents. The yellow, American Indian or Alaska Native birthing parents. The bluish gray is for Asian or Pacific Islander, and red is for other. So when we break it out by race, it's very clear to see that if you are a Black or brown birthing parent, you are at higher risk for stillbirth than the white birthing parents are.
And this is Missouri specific data. So this comes from Missouri Vital Records. Yep.
Yes. So why are there these disparities in birth outcomes? Well, Count the Kicks has done research which has identified the following, and I just want to also point out that all of our research we cite, and The sources are located at the bottom of our slides, and every participant will be emailed a copy of this presentation, so you will be able to look at these sources for more information. But the first reason is for systemic racism, or the way that our society has fostered racial discrimination through the systems, such as housing, not being able to qualify for a mortgage, education, going to a school that's overcrowded and underfunded, employment, not being called for a job interview because your name looks black on your resume, earnings, not being offered the same wages as white counterparts in the same exact jobs, media perception, healthcare, and criminal justice. Epigenetics. This is how good and bad life experiences passed down through generations can affect how DNA interacts with genes, like which genes are expressed or turned on and off due to the environment a person is in. So think about years of trauma and getting treated unfairly in an unjust system can and does have lasting health effects. Predisposition to certain conditions like gestational diabetes, preeclampsia, these can increase rates of stillbirth. Access to healthcare can obviously impact early diagnosis and treatment of concerns. Socioeconomic barriers. So think about not having paid leave from your job to go to your appointments, not having access to transportation, not having access to childcare. All of these things are barriers that increase rates of stillbirth. And a very important takeaway for everyone is that research shows education is not a factor. So a college-educated Black mom is still higher risk for her baby being born still and for her dying herself than a high school educated white woman. And at Count the Kicks, like Megan alluded to earlier, health equity is at the center of what we do because we know that our Black and Brown families are disproportionately affected, so they are at the center of what we do. We have kick counting bracelets, which are for parents who do not have access to smartphones, who don't have access to the web counter, so that they can still learn what's their baby's normal movement without having to use technology. Our app right now currently is in 16 languages, and that number is always growing. We conduct health surveys of social determinants to make sure that what we're doing is applicable to our marginalized communities. And right now we have a big push for reaching out to non-traditional providers like places of worship, because we know that they are also seen as trusted sources of information. So we want to make sure that they have the most evidence-based information to give out as possible.
Thanks, Erica. And I'll just add too, part of our partnership with Healthy Blue, we're bringing the social determinants of health survey to everybody in Missouri. So when you're using the app after the second kick session in a couple of weeks, what will happen is you'll be asked if you want to complete a survey, simple yes or no questions, all around social determinants of health, because we know we have access to people prenatally. So if we can connect the dots for them, get them access to resources, doula care, childcare assistance, diaper banks. If we can do that prenatally, the chance of that baby experiencing childhood adverse experiences decreases dramatically. So with this partnership with Healthy Blue, we're able to bring the survey to everybody in the state of Missouri. So it's going to be a great tool to connect the dots for people and help bridge that gap. So let's dive into a little bit more of the research and evidence. We've been talking about it this whole time. What is the evidence? This is the evidence on your screen. This is the one that started it all. And what I want to do is just kind of highlight an overview of what this looks like. And so when I say this started it all, this is what I mean. We were founded by 5 central Iowa women who all experienced stillbirth or infant loss in the early 2000s. They didn't know each other at the time of their loss. They got connected through friends and pastors. And as they were meeting for coffee and grieving together, what they realized was, here we all sit, relatively similar stories, yet we're getting told this isn't that common. We're getting told it's like getting struck by lightning, but here we all sit, it's obviously more common than people think. So fast forward a couple years, I'm going to jump up here, but a couple of the founders were at a public health conference where they heard some researchers out of Norway talk about this research study that they had done that showed when expectant parents were educated on getting to know what was normal for their baby in the 3rd trimester, and that's key, what's normal for their baby, and we're going to talk about that language here in a little bit. What's normal for their baby in the 3rd trimester, when they were educated on this and they spoke up to their provider when they noticed a change, the stillbirth rate among this cohort in the study decreased around 30%. Amazing, right? Just by educating on getting to know what was normal for your baby. So the founders hearing this research came back to Iowa, said, great things start in Iowa. Let's create a public health campaign that gives providers tools and resources to easily be able to talk about stillbirth and stillbirth prevention, but also the tools and resources for expectant parents to understand the importance of tracking their baby's movements in the 3rd trimester. So they worked with Iowa Department of Public Health. They looked at additional research and evidence around fetal movement monitoring, and they created the campaign that you know about today, that Count the Kicks, that bright, colorful, empowering campaign that we're spending the next 30 minutes finishing talking about. Dr. Ruth Fretz, she was the only United States researcher on this study. She also now sits on our medical advisory board. There's other evidence out there. It's not just that study. We have a whole page on our website dedicated to the evidence behind fetal movement monitoring and Count the Kicks. We're really excited and proud to announce to you today that we were recently published in AJOG, which is the American Journal of Obstetrics and Gynecology, and BJOG, the International British Journal of Obstetrics and Gynecology, showing how when expectant parents utilize the Count the Kicks have better birth outcomes. So again, you don't have to like scan these codes right now. We'll send this to you after the webinar, but I do want to highlight some features from that BJOG article in this video, because if you're one of those people, and I get it, you don't want to read pages and pages of research study, totally okay. We've drilled it down into a couple videos. So let's watch one of those videos right now.
We know that there was no other sort of public health campaign going on in Iowa related to stillbirth at the time, and we know there's a relationship between the activity of Count the Kicks and the changes in stillbirth rate.
Prominent stillbirth researcher Dr. Alexander Hiesel led the study that shows birth outcomes improved when moms learned about Count the Kicks.
And I think there was no doubt from the data that we saw a massive jump in the app downloads when there was a TV appearance. And I think ultimately as human beings, we are hardwired to listen to stories. You know, you can hear people like me talk about data all day long, and after a while people's eyes kind of glaze over and you can see that you've lost them. If you combine that with a story from a mum who kind of, you know, as you said, narrated how her experience identifying that her baby wasn't well because it wasn't moving normally, and then someone listened to her, took it seriously, did the tests that were needed, the test showed that there was a problem and the baby needed delivering, then that people listen to that and it touches them somewhere that numbers just don't.
Research shows that in Iowa, when more moms used the Count the Kicks app, more lives were saved.
Count the Kicks has had such an impact in helping mothers believe in themselves and believe in that they know what's happening within their own bodies, and then their ability to talk to a doctor in a way that they'll listen to, that the mom does know what she's talking about, because it gives them the tools to be able to show to the doctor when there's been a change in those kicks.
The Count the Kicks app is a data download for your intuition. Paying attention to your baby's movements is a great way to monitor your baby's health in the 3rd trimester. Download the free Count the Kicks app and get counting today.
So this is that 32% reduction that Dr. Hiesel talks about in that video in graph form. So in 2008, Count the Kicks was created. From 2008 to 2018, we saw that 32% reduction in the stillbirth rate here in Iowa. The African-American stillbirth rate here in Iowa decreased around 39% in the first 5 years. So this is the type of decrease and graph we want to see happen in Missouri. So how do we do that? This is one of my favorite parts of the presentation, because right now, while you're at your computer, we have the time. I'm going to play this fun, upbeat, happy song. It's Wednesday, it's middle of the week. I want you to go online, scan the QR code, go to Count the Kicks, or my colleague is going to put in the chat. I want you to go and fill your shopping cart. All of these print materials are free in your state. Posters, brochures, app reminder cards, all in English and Spanish. There's no reason not to order these. So go ahead, take a couple minutes, don't go away, come back, because we got lots more to talk about. But let's go ahead and place an order right now, and then you'll be entered to win another gift card drawing that we talked about earlier. So place an order now, you'll be entered to win a drawing, and then we'll circle back to how to talk about this with your patients.
Sunshine, she's here, you can take a break. I'm a hot air balloon that could go to space. With the air, like I don't care, baby, by the way. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Here come bad news, talking this and that. Well, give me all you got and don't hold it back. Well, I should probably warn you.
So I'm going to stop there because I know we can multitask, and I want to make sure we have time to talk through everything else. But please go order materials throughout this presentation. You'll be entered to win a gift card to Amazon. Really exciting. So keep doing that. Use the chat that we talked about, and we'll talk more about how to utilize those materials later on. I also want to address that there's no adverse effects for talking about Count the Kicks, for implementing stillbirth prevention, Count the Kicks, fetal movement monitoring into your system. I think as individuals and humans, we tend to go to that like almost worst case scenario. This is going to increase C-section rates. This is going to increase calls to my providers, to my nurses. This is gonna make my patient anxious. We hear this time and time again, and I'm here to tell you that doesn't happen. There's research out there. This does not increase hospital utilization. In Iowa, where we've had that 32% reduction, we have not seen an increase in the C-section rate. I have a couple other studies cited here, but one I wanted to pull out that quote where it says, usually the fetal movement count is reassuring to the pregnant woman and prevents unnecessary visits. And I'll tell you why in a minute. We've also done our own study with Des Moines University and the Harkin Institute, where we surveyed thousands of app users and found that 84% of our app users stated that regular tracking was associated with feelings of bonding, and 77% of app users reported feeling less anxious, because like you heard earlier with Erica and baby Ruby's mom, it quantifies. It's that intuition, that data download. Using the app quantifies how your baby's moving. So now you have data in your hands to share with your provider to say, I know this is not my baby's normal, because my baby's normal for the last 2 weeks has been 15 minutes to get to 10 movements, not an hour and 15 minutes. Just like Erica's story with Bear, where she said, no, this is not my baby's normal movement. I need to be seen. I need to be monitored. So it gives us the tools and resources to have that in our hand to go with our provider. And then we know when to speak up. We know how to speak up, because that's what we're doing. There's also added benefits that I don't think we always think about. Reduction of preterm birth rate, fetal growth restrictions are identified earlier. Kind of like Maria's story, where a change in fetal movement would have shown a fetal growth restriction that we could have maybe done something to prevent and get baby here okay and safe, and things like that. So we don't know, but that's what research shows that this can help with. It's not the end all be all. It's not like you have an automatic C-section when you go in with a change in fetal movement. There's a protocol. There's different things that the providers will do with you, like a non-stress test, a biophysical profile that you do. So it's kind of like a check on baby. This is how baby communicates with mom. We also know that women who have stillbirths are substantially higher risk for severe maternal morbidity than women who have live births. You're 4 to 5 times more likely to die if you have a stillbirth. So not only are we preventing preventable stillbirths, but we also have a chance to save mom's life as well. So this quote again from the study that says, due to the low cost and potential benefit, it is recommended. Decreased fetal movement can indicate a need for more evaluation and has the potential to save lives. When we think through that connection between stillbirth and maternal mortality, one of the things that we did at Count the Kicks is we drafted and created and worked with researchers to create this white paper on this connection, where we looked at real American women and their stories of how they almost lost their lives or could have lost their lives if they hadn't been using Count the Kicks. Not only did it save baby's life, but it also saved their life as well. So you can read this full white paper on our website. We also have videos that talk about it as well. Just a great tool for you to have and more of that evidence behind this program. So now I'm going to throw it over to Maria to talk about why this is important and how to have this conversation. Go ahead, Maria.
Yes. So why does movement matter? We know that movement is one very important way a baby communicates before birth. A change in a baby's movement can be an early sign and sometimes the only warning that a baby may be in distress. So when we're thinking about when we should start counting, we start counting when ACOG recommends beginning counting at 28 weeks gestation or 26 weeks if considered high risk or pregnant with multiples. This is when research indicates baby has established a consistent pattern that mom can feel and track. What counts as a movement? These were things I wish I would have been educated on. Rolls, kicks, jabs, swishes, pushes, anything except for hiccups. These are involuntary movements. We're gonna watch a quick video and it's gonna show you just how easy it is for expectant moms to use our app.
The Count the Kicks app, a cutting-edge, powerful tool for expectant parents in the 3rd trimester of pregnancy, has a new feature to help you monitor your baby's movements. The new strength feature allows you to rank the strength of your baby's movements on a scale of 1 to 5, from fluttery to fierce. Research shows paying attention to the strength of your baby's movements is vital. If a baby's movements becomes weaker, studies show this could be a sign of potential problems, and expectant parents should alert their doctor. The free Count the Kicks app now gives you the option to take notes on your session. Our app is available in 12 languages in the Apple and Google Play app stores. It is a simple and non-invasive way to monitor your baby's well-being every day in the 3rd trimester. Features include kick counting history, daily reminders to count, and the ability to count for single babies and twins. Simply tap the footprint every time you feel a kick, roll, or a jab, and the app will time how long it takes your baby to get to 10 movements. Log in to save your kick counting data and get to know what's normal for your baby. Be sure to speak up and tell your doctor if you notice a change in the strength of your baby's movements or how long it takes your baby to get to 10 movements. Hospitals are open 24/7 and are ready to listen to your concerns. Join the community of expectant parents who are in tune with their body and their baby by counting kicks daily in the 3rd trimester. You can also find it on Apple Watch. Download Count the Kicks and start counting today.
She said 12 languages. It's actually in 16 now because we shot that video and then we had additional languages added. So it is free. There are no ads. There's one daily message that comes up after a kick session. We control it. It's usually educational or trivia. So it's in 16 languages currently. Let's talk about a little bit more how you use it and some of the features. So it's available on the Apple or Android products. I would love for you to go to your app store right now, search Count the Kicks, download it, because I want you to use it. I want you to see how easy it is to use, how simple it is to use. So every day, that's key. Every single day around the same time, that's the biggest takeaway. Every single day around the same time, I want you to encourage your parents to count. That's when they're going to start to notice that pattern, that trend. After just a couple sessions, they're going to start to see that. And the app shows them that. It's a visual representation of how baby's been moving. So like you saw in the video, you just tap that footprint every time you feel baby move and a timer starts, all the way until you get to 10. Once you get to 10 movements, the timer stops, and now the app asks you to rate the strength of those movements. How strong was baby feeling? Everything from fluttery to fierce. If you think back to that video of baby Ruby when her mom said, her movements just felt weaker. They felt softer. That's also really important to pay attention to. So after you rate the strength of those movements, what happens is you get a graph. You get a graph of how long it's taking baby to get to 10 movements and how strong baby's movements are. So after a couple of sessions, you get to see the average amount of time. So if I've been counting daily around the same time for the last 2 weeks, I get, 10 movements in 15 minutes. And one day I'm counting and I get 10 movements in an hour and 15 minutes. That graph is going to change. It's going to shoot up. So it's going to indicate to me as the user to say, that's not my baby's normal. I'm going to contact my provider and work with my care team to see what the next steps are. Or it's after hours, I'm going to go directly to my OB/ED, my ED department, my birthing center to get checked out, because hours and minutes matter when it comes to this. So we want to make sure that we're getting checked out. Some other features is you can go ahead and set a daily reminder within the app. You can review kick counting history, download the history. They can share it with their provider. If you are not their provider on this call, but you're interacting with expectant parents, encourage them to download and share this with the provider, even if their provider is not talking about it. Because one, hopefully this triggers their provider to start talking about it. And two, it empowers them to speak up to their provider about it. So then the provider's listening and they say, oh yeah, let's talk more about this. And then monitor the strengths like we talked about. Another way that we recently launched, so if you heard about Count the Kicks before, perhaps you haven't known about our new feature. We now have a web-based kick counter. So not only can you count on the phone, on your Apple Watch, but you can also count the next day on a PC. So you can just go to the web and it's all connected. So you can count 3 different ways essentially, and all the data is still right there. This is a way that we are working to be more inclusive, so people can count anytime. Maybe they're at work and they can't take out their phone, but they know they need to count at 2 o'clock in the afternoon when baby's most active, or they need to go to a library because they don't have Wi-Fi broadband access all the time. Or they just like to count on a PC, like me, I'm at my desk all day long. This is another free resource. It's in all the languages that the phone, it functions exactly the same way as the phone. So another resource that we wanted to show you, and you'll see that on the start counting page that I know Sarah had referenced in the chat. Another way that we're connecting is that social determinants of health, right? So what we have in the resources section is a way for people to enter their zip code and to find free or reduced cost resources in their area. So they can find that doula care, they can find the birthing centers, they can find the doula or the diaper banks and childcare systems. So it's all based on zip code, or they could search by their work. So we want to connect the dots and help people find those resources easier and more accessible. So we talked about the app, we talked about research and data. Now, how do you take all of this and how do you take what you ordered today and share it and implement in your workflow? One thing that we really wanted to highlight was the fact that when you're having these conversations with parents, you're improving their health literacy. And we know that health literacy is one of the strongest indicators of an individual's health status. So how are you improving their health literacy? Because you're being equitable, you're avoiding assumptions, and you provide all expectant parents, no matter their race, gender, religion, socioeconomic status, the same information every single time. You're listening and you're learning. You're asking strategic, open-ended questions. Maria and Erica had talked about this earlier, right? Instead of just saying, have you felt baby move yet? Yes or no? Tell me about your baby's movements. What questions do you have about your baby's movements? Open-ended questions. And then you're being clear and concise. You're avoiding long or complex explanations. Today, I've talked a lot about and used the terms fetal movement monitoring. I wouldn't be using that terminology if I was talking to expectant parents or in a childbirth ed class. I'd be talking about baby kicks and baby movements and explaining, like Maria did, that those are the pushes and the swishes and the jabs. That's the type of language I would be using. And you're being honest. We talk about so many things with pregnant people. I was so nervous to eat cold meat. I was so nervous to eat the ice cream from one of those soft serve machines because of listeria. That was just, built into me from Google and my doctor and everything, but yet nobody talked to me about stillbirth and stillbirth prevention. And I guarantee I would have listened. I would have been like, oh, there's something I can do. Like, absolutely, I'm gonna do this. So you're going to be honest and you're going to speak the truth with empathy and compassion. And then you're going to reteach. So this is why it's so important for you to talk about every single time you see somebody in the third trimester. So if you're a home visitor, you see them every 2 weeks, you're going to talk about it. If you're a provider and you're starting to see them weekly, you're going to talk about it. I want parents to see this in Missouri in a restroom, in a library. I want their provider to talk about it. I want their doula to talk about it. I want them to see social media ad. The more the merrier. That's how we're going to get that system change, and that's how we're going to save more babies together.
Now we're going to talk about why we need to talk about stillbirth with expectant parents. And a little important note is that I know you all aren't providers, but you all come in contact with birthing people, and a provider's influence is so strong on expectant parents on why we need to pay attention to our baby's movements. We did a survey of our app users in spring 2022, and 87% of them said that they would contact their provider about a change in their baby's movements if their healthcare provider had encouraged them to speak up about a change in movement. So a provider's influence on expectant parents is strong, and they need to hear from you and everyone else about why this is so important. You might be thinking, well, I don't want to scare expectant parents. Just like Megan said, pregnancy is full of risks that we are educated about, not changing the cat litter, taking our prenatal vitamins, not eating lunch meat. Stillbirth is just another risk that we should be educated about so we can be empowered to speak up. You might be thinking, stillbirth just happens, there's nothing we can do. That's wrong. A lot of stillbirths are preventable, and there can be warning signs if expectant parents know what to look for. Well, my baby is always active, it's not really a concern. Obviously, babies are going to be active until they're not, and a lot of stillbirths are sudden, like cord accidents. So if expectant parents are educated on what the red flags are, they can speak up if they notice a change. And well, I'm almost to my due date, it's not a big deal. I don't really need to talk to them. No, the risk of stillbirth increases the closer the expectant parent gets to their due date. So now we're going to talk about myths and misconceptions. And I will just say, if you've been falling asleep, please wake up. This is probably like the most important part of this presentation to me is what these myths are, and we're out here to bust them.
Yes. So we're going to start, and I will say, just like with Erica, a lot of these are what I believed, and I believed them with all 3 of my pregnancies. It took until I dug deeper and had the courage to do that and found Count the Kicks to find that these are myths. They are not. They're misconceptions, and people need to know about them. So the first is, my baby is always active, so I don't need to count the kicks.
Obviously, babies are going to be active until they're in distress, and sometimes this can happen quickly and without warning signs. So if you're tracking and getting to know what's normal for your baby, that's going to take the guesswork out of, is my baby slowing down? Has there been a change? This is going to give real data so you can show your provider if there is a concern.
The next is, only those experiencing a high-risk pregnancy should pay attention to their baby's movements.
False. Some of us were not high risk until our babies died. So all expectant people should be educated on Count the Kicks and get to know what's normal for their baby.
My baby should get 10 kicks in 2 hours. This is when I believed with all 3 of my pregnancies.
Yeah, this is false. This is outdated advice, and every baby is different. So the new guidance is, get to know what's normal for your baby. My baby might take 10 minutes. Her baby might take 20 minutes. So telling an expectant parent that 10 and 2 hours is fine, if that's not their baby's normal, then that could be a red flag that their baby is in distress.
I can just use a Doppler device to monitor my baby's well-being.
No, please throw the home Dopplers in the trash. A change in a baby's heartbeat is one of the last things that's going to happen before a stillbirth. And many stillbirth parents, including myself, had appointments the day before or the day of where they did a Doppler and the baby's heart rate was fine. People at home aren't trained to interpret these Doppler results. So if there's ever a concern on baby's movement, go get checked. Think of it like if you see somebody passed out in the street, you go take their pulse, they have a pulse, you just leave them in the street. No, we would not do that. We would take them to the hospital. Same thing. Go get checked.
If baby isn't moving, I should drink something cold or eat something sugary to get baby moving. This was one I was unfortunately told over the phone.
Yeah, same. Research shows that this is also outdated advice, that we should not use interventions like sugary drinks or snacks or cold drinks to get baby to move. Spiking the parent's blood sugar is not going to help a baby in distress, and at best, it's going to delay that parent getting the care that they need. Kick counts are best done without interventions like these. So again, the theme here is if something doesn't feel right, if the normal has changed, go get checked.
And I'll just add here, because it's similar to when you and I are sick. When we're sick, we rest, we conserve our energy, we're sitting on the couch, we're laying down. Same with baby in utero. If something's going on with baby, whether it's infection, low amniotic fluid, cord issues where they can't move, they're conserving that energy. Why are we trying to force baby to move? Just like we wouldn't drink a bunch of Mountain Dew to get to, move and go about our day if we're really sick. Same with baby. So those interventions, or we don't want to do fetal movement monitoring with those interventions.
Baby kicks less near the end of pregnancy.
No. Babies do not run out of room near the end of pregnancy. The types of movements may change, like it might be fewer kicks and more rolls and jabs, but the frequency, how long it takes, the strength, that should remain consistent up to and during labor.
Pregnant people should avoid dental care.
This is an important one we like to throw in because there's a misconception, but good dental health is always important, and pregnancy can increase an expectant parent's risk of dental issues, thus overall health issues. So please receive dental care during pregnancy.
And last, triage doesn't need any Count the Kicks education.
We believe every place should have Count the Kicks education, but especially triage, because people are going in there if they have concerns. So we have posters, brochures that you can order, but we also have the ability for your system or your center to add Count the Kicks information to the discharge paperwork, so that if anybody's being sent home, they have the tools they need to speak up and get checked if they feel like something is off.
Thanks, Erica and Marianne. So we're almost at the end, so stay with us for just a couple more minutes, but this is how you can integrate into your health system. Ensure everybody on the team knows about this information, share the recording, share these videos, include Count the Kicks in your paperwork, your intake forms, your after visit summary forms. We have gold standards, we have sample messaging that you can use. Discuss it every single time you meet with your expectant parents, and share throughout the community. You guys are the boots on the ground. You are the reason this is going to change in Missouri. This is just a gold standards example of what our after visit summary report looks like. So if you'd like to implement this and integrate it into your health system, feel free to contact me. I love talking about systems level change. So feel free to reach out and we get you the information you need, the training that you need, anything. Maria's going to wrap up with some just additional resources, and then we'll have time for questions if you like.
Maria, you're muted.
Sorry. So we do have CE trainings. It is 2.25 CEs, and the purpose of this educational activity is to train healthcare professionals how to talk to their patients about fetal monitoring, using the best practices to track fetal monitoring. And you can use the QR code or just go to our website and it has all that information there as well. And then we also have all of our amazing free resources, educational materials that we've talked about, our posters that are in English and Spanish, our app cards, at-a-glance materials, magnets, brochures, and then there's additional free resources like printable kick counting charts that we have as well. So we are going to wrap up our afternoon with a few more baby saves that are both really powerful. I can connect to both of them, just of why we're here today, right? To save families from going through trauma their whole lives, to get these babies here safely. This is baby Mabel, And her mom said that the only red flag that there was a problem with the pregnancy was her daughter's change in movement. I am so grateful I had the concrete data from the app, which gave me the knowledge that something was off and the confidence to advocate for my baby. All moms deserve to have this knowledge so their babies can have a healthy birthday too. From Megan A., Mabel's mom. And our next one, we actually just added this one. This is one of my most favorite baby saves. This actually just came in on Sunday. This is baby Brody and his mom, Hannah. She had had 2 pregnancies, and with both pregnancies, she had been educated on our Count the Kicks app. She had used it with both of her pregnancies. Every time she went in the 3rd trimester, she said that her providers talked with her about her baby's normal movement patterns. So she felt very confident sharing how her baby's movements were. She would get her app out, they would review baby's movements. So she knew her baby really well. One thing to note with this baby, this mom did get some extra monitoring because they had found some antibodies had developed, specifically small c, and so she had some extra monitoring. But at her 33-week appointment, she had her biophysical profile, and Brody passed it with flying colors. He was doing amazing. The very next morning, the mom felt decreased fetal movement, and Brody was always very active in the morning. Her words were, it was a night and day difference of what his normal was. And so she had that power. She knew she could prove it. She could show the data on her phone. She went in immediately because she knew something was off with Brody. They did an NST, and then they went ahead and did another biophysical profile. Within that 24 hours of that BPP, he scored a 2 out of 10 the next day. He failed it. And they did an emergency C-section. He was born within 5 hours of her voicing her concerns. He had the cord wrapped around his neck 2 times very tightly. Born living, look at those beautiful eyes. And so she knew, she said, when I arrived at the hospital, they took her very seriously. And she's convinced that Brody's life was saved because the doctors and nurses at Mary Greeley Medical Center educated her with the Count the Kicks and empowered her to advocate for her baby. She knew something was going on with her baby, and just knowing that biophysical profile, it's good for that acute moment, right? It's good for that time, that snapshot in time. But within 24 hours, things had changed. And when I had my BPPs with my last 2 babies, I had been told, like, within a week, your baby's good for a week. We'll see you next week. You're fine. This proves that that's not true, that something can happen quickly with that baby, just like something can happen quickly with us. You're okay the day before and not the next day. Her only sign was that decreased fetal movement, and she had the power to advocate. She could prove it. This is not my baby. This is not how he moves. So this story was just super powerful. And these are stories we see coming in daily, more stories that we want to see of parents welcoming home their babies and having that lovely life after that they dreamed about with their babies. So we are going to watch one last story. This is baby Nala.
She came back in after she had me put on the monitor and stuff, and she's like, we're just gonna take her. And I'm like, what? And she's like, you know, her heart rate is dropping every time you have a contraction. I was already scared, you know, because I was a high-risk pregnancy. Well, I basically learned from the doctor's office, the little yellow sign that was right there. When she started moving, I was very alert with her movements, you know. That was what I lived for, just because I wanted her to, you know, her to make it and survive. When she started moving, she moved, and she was consistent. It was always at a certain time. Nala was a kicker. When she started kicking, she was kicking. And this day, she wasn't moving at all. I started drinking cold water. I mean, I was drinking so much, my stomach was hurting to make her move. And she didn't move at all for me at all that time. So I'm just like, okay, I'm gonna get her checked out. It was the heart rate that was dropping. Like they said, her heart rate would drop real low every time I would have a contraction, and they were like back to back. She thought that it would save the baby, so she pulled her out. She was like, it's a good thing you came when you did, you know what I'm saying? Because if you wouldn't have, you know, we probably wouldn't be having the same outcome. I think about it every day, like, oh man, what if, you know, what if? Definitely to pay attention to count the kicks, you know. I feel like it's important just because had I not, you know, knew to do that, Nala wouldn't be here. Don't second guess yourself. Don't feel bad or stupid. Don't worry about insurance or the emergency room bill. Go check on your baby, you know, because your baby might not be here. You just pay attention, you know, seriously. Like, it's your baby's life.
So thank you for staying with us today for a couple extra minutes to hear baby Nala's story. I love what her mom says at the end, where she says, go check on your baby. Don't worry about the bill. Don't worry about this. Go check on your baby. And that's the message. So feel free to follow us on social media, share this information, reshare. We have a YouTube channel where you can access all of these videos to share. That storytelling aspect is so, so important. We're happy to answer any questions that you may have. Thank you for giving us about 66 minutes of your time today. We're so appreciative to help save babies with you all in Missouri. Thank you so much to Healthy Blue for this partnership that we could spend this time with you today. And we're so very grateful. So happy to answer any questions. We'll leave you on this slide here with some additional baby faces. And then this slide deck will get sent out to you within the next day or so with the recording and everything like that. So we'll stay on for a couple more minutes if you have any questions. Otherwise, I hope you have an enjoyable day. Thanks for working with us. Thanks for being those boots on the ground. And stop recording. Thank you, Christine.